No mai whakatau mai ki te Puna o Waikato. Kia ora everyone and welcome to Trust Waikato, but welcome to our Puna Koorero session. It's a delight to have our final session for today. Hoi anō. I will start us off with a karakia and then we'll go through what we're going to be discussing this afternoon. Nō reira mi noi tātou. He honore he karoria ki te atua. He mau ngā rongo ki rungi te whenua. He whakaro pai ki ngā tangata katoa. Nō reira e te atua. Whakatata mai ki a mātou e tēnei wā. Arahia iwa mātou mahi. Kia mārama, kia tika. Mō ngā tangata katoa. Rire hau. Pai marire. So welcome to our session. So this is our second session, and we're really fortunate that we're going to hear from a number of voices. So our session will provide an iwi voice from Maniapoto Māori Trust Board, a local government voice from the Waitomo District Council, and a health voice from Waikato District Health Board. And we will also have time set aside at the end of the session for you to ask any questions by utilising the chat function. So probably one of the key things, we just want to recap on our first Puna Koorero session that we had, and we were really fortunate to have Dr. Rawiri Jensen and Dr. Jade Tamatea. And one of the key takeaway messages that they had shared with us in our first session was around protection. So protecting ourselves and our communities around COVID. And one of the key areas was around ensuring that we get vaccinated. And vaccination is a key protective tool for all of us to consider, and also around being prepared. So being prepared is, what does it look like if your whānau were to have to go into isolation? So having probably a whānau plan around if you need to go into isolation. And then also another key message was around the community and having plans to support the preparation and execution of these. And the last point was around working together and having a coordinated communication plan for the whole community to get through this. So it is my pleasure to hand over the kōrero rākau to our panelists, which I'm going to get them both to introduce themselves, and I'll hand it over to the Mayor of the Waitomo District Council, John Robertson. Tēnā koe te rangatira.
Tēnā koe, Rongo, and kia ora everyone. It's a real pleasure to be here and to talk on such an important topic. Gosh, you know, I guess that all this has come about in 2 years, and we have a pandemic that the world's struggling to cope with right now. My name's John Robertson. I'm the mayor, as said, of the Waitomo district. I was brought up in the district, a little town called Piu, and you know, so we're in a very much a rural setting there. Went away for a while overseas, came back to Auckland and spent some time in public and private life. So public life in Papakura as a MP in the early 90s, and then as the mayor in the about 10 years after that. And so I've been able to enjoy the challenges, I guess, of public life. And as with the topic we're talking about today, public life always throws up really interesting issues, tough issues, controversial issues. But that's probably the reason some of us enjoy it. So kia ora.
Tēnā koe, John. Kaya koe, Janise.
Hi, tēnā koutou, ko Waikato Maniapoto tōku iwi. Hi, I'm Janise Eketone. I work for the District Health Board. I'm the Māori and Pacific Strategy Manager for the COVID Directorate, which is a new directorate. We're now treating COVID as a BAU, business as usual, rather than a critical incident management issue. So I'm pleased to be invited, and thank you very much.
Tēnā koe. Kia ora, Dennis, I'll hand it over to you just around setting the scene around what the panelists are going to be discussing and presenting this afternoon. Kia ora.
Thank you, Ronald, and glad that both you, John, and Janise are here to talk with us today. It is, I think, as both of you have said, quite a different time that we probably expected to see ourselves, and we never probably thought that we would be living through a pandemic like this. It was really interesting with Rawiri and Jade and our first Puna Koorero around what they were seeing were the important things that we should be considering. And it was around that preparedness, both from a community and a whānau level. And that's what we probably wanted to talk about today and explore. But before we get to that, Janise, I wonder if you can just give us an update from your knowledge of what's going on within the DHB, a bit of a picture of how COVID is evolving and what you think are going to be the pressure points as we go through the summer and leading into winter.
Kia ora, Dennis, kia ora koutou. So you know that yesterday the borders with Auckland opened and people are enabled to travel now. We've moved from the elimination phase into a suppression resilience phase. And in doing that, we're getting ready for endemic COVID. So where COVID will be like the flu, or and it spreads more easily than it has done in the past, because we've had a lot of public health measures in place. But those settings are changing with traffic lights coming in. We think the pressure points that are coming towards us are, we have a tired workforce, health workforce in particular, and no doubt in your NGOs and other organisations that serve communities, they're also experiencing a bit of weariness, fatigue, or COVID fatigue, I think. So that's a reality, and we've got the holidays coming up, and not all of those teams are able to have breaks because they're critical services, particularly our hospitals. So we're sorting out or enabling a voluntary workforce, people who want to volunteer into some of these spaces. We're vastly developing a unregulated workforce to help with swabbing, vaccinations, running mobiles. Really interested in if organisations see that as part of their support in front of us. The other part is helping families to become prepared, as Rawiri and Jade were talking at the last Puna Koorero. Kia ora, Keith.
Kia ora.
And particularly inside communities, so quite a few of the communities, and no doubt John and Keith will speak about it more, developing community coordination hubs that are ready to also take on some of the things that our public health units have been doing, because our public health unit is getting ready to scale up. And so there's certain things that can be moved out into the community and supported by the community, so the public health team ready for surge cases.
So Denise, how can people connect to actually volunteering their services? So where do they go to, or how can they?
We had a wonderful conversation this morning with Dennis, who suggested a conversation with the Waikato Volunteers Service. So if we can keep that conversation going. We also have hub leadership. So they could approach some of the hubs, and Keith and John are leading hub development in the Te Kuiti Otarahanga area. We have iwi collectives in Taumaranui, in Raukawa, and Hauraki, in Huntly, in Matamata Piako, that are all getting their hubs ready too. So yeah, you can approach the local Māori providers that I'm sure they would appreciate volunteer services and help.
Cool. Kia ora, Keith. Welcome. And I wonder if you had the opportunity just to introduce yourself, and then we can come into some questions of you as well.
Well, kia ora, everyone. My name's Keith. I come from Ngāti Maniapoto, related to Janise, and live in Pio, and I chair the Maniapoto Māori Trust Board.
And congratulations on a lot of work, but particularly this year's work, and where you've gone through a settlement process as well. I think that's a fantastic.
Yeah, well, Janise was a very big part of that, actually. She was the engine room that got that whole thing moving. So I haven't had a chance to acknowledge you, Janise. We got it over the line.
And I wonder, Keith, if you could just give us a view. We've heard from Janise around developing community plans to deal with COVID, and give us a view of where Maniapoto are at and your planning and coordination around this. If you could give us an overview before we go through to John.
I think what's been really important is the relationships within our community. You know, the relationship that I have with John and with Max and with Jim as the local mayors, and then, you know, the wider community critical relationships in terms of the, you know, the health providers, the DHB, community organisations, schools. I think what's been critical actually within our community is for the wider community to see the iwi mayor's relationship, which I think has been at the core of the work that we've been doing within the rohe, and just for them, because we have a weekly community come together every single week. You know, our mayors are on those calls with us and the wider community, and it just sends a really strong message to the wider community around how strong the relationship is and how committed you know, the councils are to working in partnership with iwi. I think it's taken that relationship to another level, and there's not been many things that you can say are an upside of COVID, but I would say one thing that has been an upside has been the significant strengthening of the relationship, the partnership between ourselves and local council. I will also say, though, that we have been frustrated by how long it takes to get things happening from between, in terms of the local level and central government. It's been quite frustrating, and it's been our biggest risk actually, and what we've been trying to do as a community. You know, essentially John and I are sticking our neck out really and saying to our community, look, you know, we're going to work together on a plan, but we haven't got the resources at a local level to be able to deliver on this. We are dependent on central government resourcing, and we are going to look pretty stupid if there is no resourcing for all of the planning work that we've been doing over months now at a community level to bring a community coordinated approach together. So the thing that keeps me awake at night is whether or not central government's going to deliver. But in terms of our local relationships, I think they're probably at a stronger, they're probably in the best, they're probably the best that they've ever been in my experience.
That's really pleasing to hear, around those trusted local relationships, and then the the strength that comes from that relationship. And John, I wonder if you wanted to comment on that before we get into thinking about what the community plan looks like. And Keith, I do take your point around central government funding, and maybe we can come back to that topic a little bit more and see how Janise can get some money to us.
Yeah, thanks, Dennis. Yeah, first let me salute Keith and Maniapoto for the leadership they're displaying in this, and you know, partnerships are two ways, and so both partners have to you know, work out how to work together, and it's been a tremendous relationship that's developed there, and I guess I hope we can show in our rohi that these relationships can work well and strengthen our communities. On the question of the importance of the relationships, you know, Keith talked about the challenge of working with central government. I've sat in central government. I understand that. Keith's been down there too, and understands that. Here we've got a situation where we have got a pandemic, and it's right to say that that means we need a national, in fact, a global response to this issue. So in New Zealand, it's being led by the Ministry of Health as the health arm of government, and it's been supported by the Ministry of Social Development as the welfare arm of government. What I would argue that we need, and I think Keith's, and we're all in the same space here, is that we need to support the initiatives from the centre, from Wellington, by local initiatives as well, if they're going in a situation like this, if they're going to be successful. And that challenge, I think, both for central government to work out how to delegate things to local, and the challenge for local to work out how we can work really constructively with central government. And then in between is where Janise is sitting there in the health side, is the DHB. And they're also kind of in the middle in some ways between the Ministry of Health and the local community. So absolutely, getting this right is important. It's not easy. There's not a lot of models for it, but we can do it.
So Keith, if you're available there, if I can come back to you, and if you could paint a picture of what the community response is looking like from your perspective, and with an iwi lens around it as well, would be interesting, please.
We've focused it around three key areas. One is around supporting our families to isolate. So we've got large, young Māori families living in you know, overcrowded conditions in our communities, and the ability to isolate is just not there. So having community facilities that support our families to get out of that home environment and to isolate properly is critical. Secondly, for those who can isolate at home, supporting them to do that and having wraparound services. And then thirdly, a centralised sort of hub that is a proactive sort of communication service hub that ensures from the point at which someone tests positive or is a close contact, from that point, they're supported all the way through their COVID journey, if I can express it that way. And there's a sort of a high level of focus around, you know, all of the well-beings. It's sort of taking it beyond just sort of delivering the kaipak. All of that's important, but it's just really focusing on the sort of total well-being of the person. Even things like, you know, people get concerned when they become a close contact, what's going to happen in their employment? You know, all of those things are really important matters. And so the wraparound centralised service is about supporting our people through those steps. So combined, that's the responsiveness plan. unanimously supported by our community, and it is now being put together and costed out, and is now sitting with the trustees at the trust board. We're meeting this evening at 7 o'clock, and I'm hoping that this evening we'll be able to get the green light to be able to sort of share that widely within our community and advocate for resourcing from government.
Thank you, Keith. And Janise, if I can come to you now and just, what are your thoughts on a community-led response, and how does that fit with the DHB view of community health as we move through the pandemic through to endemic?
Kia ora. It's really clear that one organisation, even an organisation like the District Health Board, isn't enough to support the communities and what they need. Local-led solutions like the community hubs are really, really important. They're part of the picture of going forward. We too are asking questions of central government about how they're going to be funded. We've got funding for wraparound services. We've got funding for assisting people to isolate in amohia. We've got funding for testing and vaccinations and those kind of things. But the pace at which our communities move isn't the same pace that our funders move at the same time. So we're working out how to do that too. We think it's the right way. It puts the solutions in the hands of communities, and they know their communities best. They know their people best. We have a team here, Marangai Ariari, that work with the public health unit that need linkages right into the depths of communities so that we can control the spread of cases, and it can only really be done through a community coordinated response, really. So yes, tautoko, the response in Taumaranui with Te Whare Taumarutanga, they've moved already. They're a smaller group. They have already been training up here in public health functions, looking for and working towards the devolution of some of those public health functions, case investigation, scoping, case management and coordination of both cases and contacts in their community hub, as well as wraparound services and manaakitanga and delivery of medications and pulse oximeters and thermometers. So it's possible. We need to get the feathers for these birds to fly.
Yeah, thank you. And before I come to my next question, we have people online watching this. If you have questions, please ask some questions through the chat or the Q&A function, and we'll obviously post those questions. John, and from your point of view, a community-led response, you must obviously have favour for that, but particularly where there's coordination with iwi across 3 district councils, that must have taken a little bit of a challenge for you to organise all that.
Yes and no, a challenge. I mean, it is critical. We've got to look at this as the council boundaries are just, boundaries that have been set up, but they're meant to be communities of interest. But when you look at the rohi with Maniapoto, that includes really the 2.5 councils, and it's been there as for over 100 years, and so it makes sense for us to think, Maniapoto, King Country, if you like. So working with the 3 councils, we have a very easy relationship. So in terms of mayors and councils, so that's not difficult. We've seen an example, I think. Well, if I can talk, perhaps even locally, Waitomo district, in terms of helping the national efforts for vaccinations, we've got a really positive vaccination rate. In fact, Janise may be able to confirm this, but yesterday I saw that the first vaccinations for Māori in Waitomo were like 89.6%. So I think we can say we've cracked 90%. And that's fantastic. That, in my view, I haven't looked over in rural New Zealand, but I suspect that's the best in rural New Zealand. And in our district, 45% of our population is Māori. So that's great. And we've shown that that effort has been facilitated not, by the national drive, by the DHB drive, but with the support of the community. So we've been really lucky with the volunteers, the health workers, the Equity Medical Centre, Whanaora, everybody jumping in, going out with mobile units and so on and promoting. So that shows on the vaccination side, this can work. We now need to implement it on the other side to support people that are suffering from COVID or who are close contacts.
John, just in terms of district council support, now you've mentioned Waipa, Waitomo or Turahanga, in your mayoral forums, is there any discussion across the whole of the rohe around having a local district council collective approach to supporting the community efforts and the other hubs that are set up or getting set up? Has there been any discussions across the whole of our district?
No, not across the whole of the region. And this is, in a way, this is because this has come at us so fast. But within, Keith talked about the weekly meeting that we have, the hui that is, we call it the iwi response team, I think, where we're all on that. So the 3 mayors that we're talking about are on that. Yes, there's that collective. So we're all in support unanimously of developing a local response unit in this sense. So yes, it's been fantastic.
That's great to hear. And Keith, I just want to expand on the holistic approach you obviously take. I mean, that's nothing new. The Te Ao Māori view, Mātauranga Māori view in terms of the holistic care, but how does that look on the ground for families that may have COVID or who have questions around COVID or who have to isolate because they might be close contacts? How will that look for them as they go through this?
One of the critical aspects in the proposal that we're finalising at the moment within the community response team, is critical aspects around the cultural well-being, the spiritual well-being. I think we just need to recognise that there is a hesitancy that some of our families have to the system. There is a mistrust that some of our families have towards the system. And, we've just got to understand that, and we've got to be open to working in different ways with different people and with different families. So there's a high level of flexibility. There's a high level of really being focused on, what will work for one individual may not work for another. And so, when I sort of talk about a holistic approach, it's just being adaptable and being flexible to consider, all of the different, issues that a particular individual or a particular whānau are dealing with. And, I'll just be upfront with you guys. We've got a pee epidemic in our community. We've got some real serious underlying issues that actually underpin this pandemic. The COVID spread through our community occurred through the trade of pee through our community. That was the pipeline. And so that's what our services, that's what our health professionals, that's what our community people are dealing with. And so this isn't a simple or straightforward solution. It's absolutely and cannot be a one-size-fits-all approach, but it needs to have a level of flexibility in our thinking, a level of versatility in our thinking, to be able to think about, the wider issues beyond just the physical health of the individual or of the family.
That in itself raises so many questions, doesn't it? And it also potentially paints a picture of what a solution may be to other community orientated issues that you face or we face, and could this be an approach community-led with support from government agencies, so flipping the model around a little bit, which could then mean we have a better outcomes for our community. I'm keen to explore that somewhat as well. We do have a question in the chat function I'd like to ask, and it comes from Joyce Maipi in Rahui Pōkeka, and not many people will know, but Joyce and I went to school together. And Joyce is asking, what are the elements considered successful for a COVID response, in 3 parts? And Janise, if we can come to you in the first instance, what do you think are the successful elements of a good COVID response?
What I've experienced this last year and this year, clear, transparent communication and willingness to collaborate and talking to the communities where the cases are happening and talking to them face to face about solutions, not about telling them what's going to be happening, because the solutions, we don't know what all the solutions are until we talk to community leadership. There are answers that government officials and Crown agencies just don't know because they don't know these communities. And like with Rahui Pōkeka, where Joyce is from, real bespoke options that were opened up. So Wāhi Pā, doing meals on, opening up their kitchen, doing meals on wheels to a really large cohort of cases. I mean, that's bespoke stuff, and only those solutions can come from communities. Good communication, good collaboration, and transparency. Kia ora.
Cool. John, from your perspective?
I love what Janise has said, and it's hard to go past that. Things like transparency, cohesion. We need to come together. We need to believe in the health message, all of us as leaders in the community, and come together in a coherent way. And then that transparency, there is that, as Keith has said, there is some mistrust, as we know, around around vaccinations and so on. So being really transparent in that sense is key as an element in that. And then I think I'm going to go to what Keith raised as other matters that influence this and the underlying issues in a community like ours. And the COVID is one thing, but if we can use this bringing together a community to also reflect on some other the matters, then it would be great to see this come together in that way.
Cool. Keith, a question for you again around the iwi taking the lead in this response, this community response, tied to the values of your iwi and your trust board and under your chairship. How does it make you feel in terms of having taking that lead? That must fill you with some pride and with some hope that this could be repeated in the future as well.
John and I have had this conversation a couple of times. I'm not comfortable with the view that the iwi have taken the lead. It's very much a partnership. Yeah. It's very much a whole of community approach. We wouldn't be in this position right now within our rohe if John and Max and Jim and the other mayors hadn't been alongside us. So it's absolutely been a partnership, and that's what's been the strength, I think, of us coming together. I think that the opportunity, you know, as we go forward into the future, to build on this as a way of working, you know, a way of us coming together, and right from the design stage of, you know, preparing or planning for, you know, initiatives or whatever, you know, really being committed to, you know, real partnership and taking things through from the design right through to the implementation, and learning together from those processes. You know, I think if we can build on that, you know, I think that there is a real opportunity for some positive change within our community. You know, it's I've spent some years on the trust board, and in previous years it hasn't been like this. The relationship with local government hasn't been like this. It's been, unfortunately, wrapped around, you know, resource management processes and those sorts of things that are inherently adversarial, and it's not helped the building and strengthening of relationships. So yeah, I think you know, the upside of this, if there is an upside, is the you know, the potential for the ongoing strengthening of the relationship.
John, any views on what Keith was just saying?
Yeah, I mean, I think this is what would I describe it as, the growing up of New Zealand, or the maturing of relationships, the understanding of history. You know, I was privileged to be in Parliament in 1995 when we had debates, and well, it was earlier than that, but when the bill went through for the first settlement with Waikato Tainui. And gosh, I remember the discussions back then in caucus. I remember Sir Robert Mahuta coming down to caucus to talk about the challenges faced by Māori and the need for some settlement and some grievance acknowledgement. This, you know, to me, this is now we're 30 years later. I think change in society takes time, but I think what Keith is saying, I put it in that big picture of, look, there's a maturing of a relationship, and in another 30 years' time, it'll be totally different again. But it is great to participate in society from my perspective as in local government, alongside iwi as this relationship develops, and we then start attending to the real needs of the real social and health needs of our communities.
Thank you for sharing that, and Keith, for what you were sharing through there as well. I just want to turn to you, Janise, and other communities may be thinking about a response and how that may eventuate. What is a way that, if communities are thinking about a joined up response, how can they go about that from your perspective, and what is a way of doing it? And in fact, what are you doing around trying to pull together further community responses in the way that this is shaped in Maniapoto?
A lot of my role is based in the community, just maintaining relationships with iwi, with kaupapa and Pacific providers, and those in my team also. So we join into their conversations. We don't actually start the conversations. We feed into what they're doing, try to be really transparent and let them know all of the things that are happening within the District Health Board, and particularly around the COVID response here. And then the communities have come to the same places by themselves. We've just added this aspect of primary, secondary, tertiary care into it, and help with the linkages back into our organisation to help pathways occur. But in reality, the communities are coming to these places themselves. They already have leaders. They already have people that they trust, and some of them are within council, some of them within iwi, some of them are within the ambulance service, within the hospital, because most of these communities have a community hospital too, and their GPs and their pharmacists, and so they actually have networks already and start coming together and having these conversations. I use Raukawa as an example. they invited us in. Oh, great. Thank you for inviting us. We're happy to be part of it. But we don't want to be we found that, yeah, being part of the conversation rather than being the starter of the conversation is more important, and being welcomed in to share, as with everybody else, as we come to the solutions that work for their communities.
And it's music to my ears when I hear that you think that the community have answers within themselves already, and those conversations can start, and then government agencies can come into that. That is absolutely, I think, the way that we should be evolving these types of responses, and then funding follows what the community is looking for under the rules and guidelines and policies that government agencies work towards as well. I think it's a great way to do it. And obviously, as a funder, philanthropic funder, we're here to support that, and we are supporting it. Keith spoke before of a little bit of slowness. Normally we would like to have some money out, but that's under discussion at the moment, and we'll get back to you, Keith, as soon as we can, but it won't take too much longer than that as well. Have you any further questions or comments as we're going through this?
Yeah, I'm just curious or around in particular what Keith, you mentioned around connecting, and especially around iwi connections, marae connections. I was just wanting to probably ask a question is around, is there any, when we've already heard about the Rahui Pōkeka response in particular coming from Wāhi Pā, is there any discussion around how marae may be able to, and what the role of the marae might be as well, in terms of places to keep people safe? I'm really keen to hear your thoughts around that. What does the role of our marae play?
We had a Zoom meeting with all of our marae chairs within Maniapoto, 47 of them, on Tuesday night. And I talked through the response plan, the high-level sort of approach and thinking around that. And there was unanimous support from all of our marae to the approach. But our marae have, they've been grappling with this issue around COVID themselves. Some of our marae have been extremely proactive. They've been available for pop-up testing for to support that part of the work. One of our marae, Kahotea marae, is a food bank supporting the Otorohanga region. So there's a range of ways in which our marae are mobilising, and some of them are talking now about what they might do to support whānau isolation. So there's some conversations that are happening that we're having with some of our marae in that space as well. So definitely marae have been, proactive in supporting, the response. They've been participant in the thinking. And they've also been, proactive in sort of supporting the testing side, the vaccination side, and also the welfare side through food banks, etc. There are also a collective marae within Maniapoto that have a weekly, karakia in the mornings and on a Wednesday morning, and also on a Sunday evening. So, there's a whole range of ways in which our marae communities have responded.
Tēnā koe. Thank you. Kia ora.
It's again interesting for me whenever there is natural disasters in this country. Marae are the first to open their doors, open their arms and welcome people in, and they're doing it again through this COVID response, and recognition of the effort that goes into that response and other responses that we've seen over the years needs to be amplified and acknowledged a lot more too, I think, as well. And Keith, what you've been just talking about there, again, reinforces to me the importance of marae within our community and the role that they play for us as well. So I just want to acknowledge that. As we're coming up to, closing this off, I wonder if we just go around and think about what we wish for in this holiday period and for the next 12 months, how things are panning out, and you know, if you had a dream, a good dream, how might that look like for yourselves and manifest? And Janise, if we come to you first, what are your hopes and dreams for next year?
Kia ora. With the Christmas period coming up, that our 4 surge teams won't be needed is my hope and pray. So we've got 4 surge teams ready to go if there are outbreaks in any of our communities, particularly in the Auckland hotspots of Coromandel. So hoping that those won't be needed, that our teams will get time to have a bit of a rest. If you're looking for vaccination sites or a testing site, it's all on the DHB website or on Health Point. There are services that are operating through the whole holiday period. 17th of January, we've been advised by the ministry to start the kickoff of the 5 to 11-year-old vaccination program, COVID vaccination program, and then linking that with the childhood vaccinations and the boosters, and then the flu season will be upon us. So I'm really hoping and praying that those families that families stay safe, get vaccinated, protect our community using those kind of mechanisms, and be prepared to, if COVID does come into your house, that you're prepared to be able to isolate and know where all your supports are coming from during your period of isolation. So, kia ora.
Thank you. John, for yourself?
Thanks, Dennis. You know, I would love this to see that this starts to come to an end, but I think the reality is we're looking at another year of learning and coping with this situation. But you know, when I think I have to say that Janise and her team, the work that has gone on, she talked about the exhaustion or the tiredness of a lot of the members. I see them, you know, I know Janise comes down to the mobile open, testing and vaccination places and so on. It's been really taxing on them. So I hope, you know, if I look forward to the new year, that we all realize the work that is being put in and the support we need to give to the DHB, the staff that are running around, to the volunteers, to the people who are working in the food banks. You know, I was in one of the food banks in Te Kuiti 2 days ago, and some of you will know Mihi and her team. My goodness, you know, they survive almost day to day, week to week, and we just need to realize what the enormous work that they're doing, and to give them thanks. So I look forward to you know, a year that hopefully this starts to wind down, but also really want us to acknowledge those that are working so hard in this space.
Thanks, John. And I think we've seen that Keith has been multitasking as we've been going through this, and he's probably had to multitask himself out of this hui. So that's fine. We appreciate Keith's time as he's come in. We know he is so busy, actually, and I hope so. He gets a chance to take a couple of days over Christmas and recuperate and get some good sleep. What for you? What about you for next year? What are your thoughts around next year and your hopes and dreams?
I hope that beyond, we are in a COVID world, but strengthening the relationships between ourselves is really, really key when we move forward, particularly at all levels, and that you know, we seriously really need to connect with each other. And also let's focus on the value add that we can bring together when we work together, rather than looking at, you know, what some of the deficits that we still need to, you know, to achieve what we want to support our communities, to achieve their aspirations. I think there's a lot of frustration around the, you know, what we don't have, but we have to really, really seriously look at what we do have, and it's around our relationships and, you know, really, really, yeah, bringing together our strengths. Is probably something that I would like to see, yeah, amplified more. So that's just something that I would love to see over the next few months.
Yeah, I think I agree with that as well, isn't it? Let's not find the reason to argue. Let's find the reason to come together and enjoy company, to not be judgmental, to respect decisions either way, which we, you know, may or may not agree. You know, I think that's a good point. And Rongo, from you, in terms of your role here at the Trust, open for conversations around funding for COVID and things like that. I know you're taking a break, but over the Christmas period, but we are open. And
certainly are, yes, yeah. Yes. Yeah. And yeah, although we're taking a break, we still, yes, are very, very, like we all are, and everyone else across our whole rohe, is that we're very, very, yeah, concerned about the unknown. Yeah, but yeah. We can draw, like I said, on each other's strengths. Yeah.
Can I just jump in there and say I do want to acknowledge Dennis and Rongo and Trust Waikato for really putting their hand up. And I know the reason I made contact a couple of weeks ago was because there was a conversation a couple of months before that where I think Dennis said something to me like, can we help? Is there any gaps? Can we help in this COVID area? Where can we help? And I said, look, at the moment, I'm not sure, but I'll come back. So I just want to acknowledge the leadership there too. This is important. I guess often funders are the important place where initiatives like this are brought together. So thank you very much.
Appreciate that, John. Yeah, look, we view this as a 1 in 100 year event, really. If you think back 100 years, they were facing the same thing in a way with the Spanish flu. So if we don't respond appropriately, then we miss an opportunity, I think. Any final words before we sign off? Janise? Cool. John? And just from me for all community, look, I hope you stay safe, have a good Christmas, rest up, enjoy company, be with your loved ones. And I'll hand over to you now.
Nō reira tātou, hoi anō, and kei te tautoko ai ngā kōrero o Dennis, yeah. Kei te tuku atu ai ngā mihi ki a kōrua ki a koe hoki, Keith, aku rangatira tō koutou kaha ki te mahi i ngā mahi, hei painga mō ngā iwi katoa. Hoi anō, māku hei whakakapi i tō tātou nei hui i tēnei ahi. Nō reira mi noi tātou. Kia tau, kia tātou katoa, te atawhai o tō tātou ariki a ihu praiti. Me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu. Ake. Āmeni. Pai māriri kia koutou.
Thank you, everybody.
Thank you.